Good afternoon, everyone. Myself Manasa from PPS1 Kuppam. Going to present a case report of Down syndrome with morning glory optic disc anomaly. Morning glory syndrome is an uncommon and generally unilateral congenital anomaly consisting of a funnel-shaped excavation of the posterior pole involving the optic disc. It is named as morning glory because of its similarity in appearance to the tropical morning glory flower and first described in 1970 by Kindler. Case report: 11-year-old girl with features of Down syndrome presented to the clinic of ophthalmology for regular examination with characteristic face of Down syndrome, who had previously documented trisomy 21, and she underwent a complete ophthalmologic and systemic evaluation to explore the associated findings. On ocular examination, facial symmetry is normal, and ocular symmetry, there is left eye esotropy of 15 degrees. Visual acuity in both eyes, it is 5/60. Anterior segment examination, ocular adnexia, mongoloid slant is present, and decreased interpalpebral aperture. Intraocular pressures are right eye 13 mm Hg and left eye 15. Pupils are isochoria and normal response, and extraocular movements are full and equal in both eyes. On dilated fundus examination, right eye, the media is clear, and optic disc, there is funnel shaped optic disc excavation with central glial tuft and thin radiating retinal vessels emerging at the optic margin. Blood vessels are normal. Macula, there is dull foveal reflex and tessellated background. Left eye, media is clear, optic disc is normal details and blood vessels are normal. Macula, dull foveal reflex and tessellated background. On V-scan ultrasonography, it showed a conoid excavation in the posterior pole with optic disc in the base, whereas the posterior pole of the left eye is normal. That is the image showing the right eye morning glory disc anomaly, and the V-scan showing the optic disc excavation. Discussion: Morning glory syndrome is a non-hereditary and usually unilateral optic nerve disease demonstrating the increased excavation, neuroretinal rim hypopigmentation, radial retinal vessels with glial tissue and a funnel-shaped arrangement. Etiology of this syndrome is still unknown. It is presumed to be due to insufficient closure of embryonic fissure and therefore may be a variant of optic nerve coloboma, or it may be a primary mesenchymal abnormality. Conclusion: Morning glory syndrome usually more frequent in females, as in our case, and most cases are unilateral, but there are rare cases of bilaterality. This case report emphasizes the importance of ophthalmic screening examination in Down children to rule out any vision relevant pathology.